whether or not people have managed to recover from it or not. Let me bring in Dr. Rachna Kochariya on this one. Dr. Rachna, we've been talking about this for quite some time, and if I look at basic differences between how India was behaving then during the first wave versus now, it is earlier we had restrictions on travel between states. You needed a RT-PCR negative test to travel. Not there anymore. There were traffic and air traffic, non-essential air traffic almost put an end to. Not anymore. There were fines on ban on not wearing masks. Not anymore. All of these sort of stringent measures that were actually significantly responsible in containing the virus, they have gone. Are we to understand from these figures now it is time to implement it? Lockdowns alone and hotspots, shutting them alone will not work?
Thanks for having me. And to your point, I'd like to say that let me take a slightly step back, broader approach. There is a term in public health called public health surveillance or just surveillance. So I think not just a lockdown approach, a very comprehensive approach that combines, the host factors, which is people, their behavior, what else we can tell them to protect themselves, to mingle or socialize responsibly, because that fatigue has set in. Virus factors, we've talked about variants, so I won't duplicate that. What's changed with the virus? So those genomics, is it spreading faster? All of that. Environment factors, what you just talked about, malls, cinema theaters. We've given a false sense of comfort to the populace, to the common man, saying, yep, we've opened it all up, come on in. So, rather than doing it piecemeal, and I'm sure that work is being done, but I'd like to see some more data in the public domain, public health surveillance, where this is done in a scientific manner, where the healthcare leadership, the public health leadership is actually leading, not in a reactionary manner. Let's react to this situation, which is bad and only going to worsen, as was said previously. But let's be watching the data, from the beginning of the year, not allow complacence, see where the clusters are popping up, collate it together, translate it into action at ground level involving communities. This is well known. This was done in previous pandemics also. And we know previous pandemics have had repeated waves. Sometimes they even plateau at a high level of infection. We have examples from other countries. Thailand has done a great job of this, taking it down, right down to the community level. So I think a little shift in the thinking of the leadership, and if they're already doing it, forgive my ignorance, but I haven't seen this coherent response, which is not reactionary to this piece of information and that, and sort of moving forward in a actual public health. We've got some very brilliant minds in this country in public health, in microbiology, in immunology, in genomics. They all need to come together and work.
And well, I haven't seen it either. I have to say we're almost seeing all reactions and no sort of preparedness for a scenario